Hi everyone, and I hope a very pleasant morning to all the aspirants of dentistry who are listening this. And this slide exclusively deals about basics in dentistry, and there will be many more doubts when an undergraduate student enters into his or her college, like why we choose dentistry. Okay, so it might be passion, it might be MBBS missing seat. Okay, so some people will be having a thought and depression like MBBS has missed and we came into dentistry. But I promise you guys, with a soulful love towards dentistry and passion and hard work, all these three will make you set a role model for all the dental students. Okay, so kindly believe my words, and there are some tips how to overcome all the fears and myths regarding dentistry. Okay, so not only dentistry, whatever the field we choose, either MBBS or the BTech or chartered accountant or whatever, we have come up with many more saturation points and we have met with the high end points. Okay, so there is no vacancies anywhere and all, so you should be among one among the one you should not be one among them, you should be far better than them. So the tips should be confident, be sportive, be positive, and love your work. Whatever the work it might be you're dealing in your undergraduation or post graduation in dentistry, you deal with that. So when we move on to basics in the dentistry, when we move on to basics in dentistry, what are the basics what we will be having is, we will be having some questions like what does BDS means, what does MDS means, and what is MBA after BDS or MHA, how can we approach towards the best positions. Okay, so one thing kindly you notice is, first, if you enter any bachelorate degree, either it might be BDS or any diploma courses, you should first have a passion towards it and you should pursue your degree in a heartful and soulful way, in spite of all the other things, like if your carvings are not getting approved or what else. Okay, so how the BDS career starts is, first is you people will start your bachelor degree with 5 years and later on complete it with either internship or go ahead with MDS. Apart from this recent era and in this past decade, we have been seeing so much aspirants moving towards masters in business administration or masters in hospital administration, which is leading many more jobs for the dentist. Okay, in the corporate sector. And next comes your abroad plans, that is MPH, or you can go with INBDE, that is where we give an exam, that is INBDE, and get a seat and pursue our BDS in US. Oral hygiene, dental chair, RCT, and restoration extraction will be the terms which we deal about in all these 5 years. So, what is a oral hygiene? Is nothing but a person's status. How do they brush? How do the deposits occur? And how often they maintain the health of the oral cavity, that means mouth. And next is dental chair. We will be the first persons who are seeing dental chairs uh, in college, and very few will be having dental visits prior to BDS joining. And next is RCTs, restoration extraction. These are the words where we use most commonly is RCT is a root canal treatment for deep caries, and restoration is nothing but cementation. So where it's cement placement. Where a layman says is cement placement, we use restoration. Pallu పీకడం, we use extraction. Okay, and next thing is, these are the basic terms and how our degree goes is. So I promise you guys, you just don't bother about your career. We can have a own clinic, we can work in clinic, and everything, the salary or the pay scale or incentives whatever, will be dealing only on your skill. So the commitment towards your dental degree and skill development are the main. Next is, so what is BDS? It's nothing but Bachelor of Dental Degree oh sorry, Bachelor of Dental Surgery. And what's the importance of BDSC? We are not no more less than an MBBS doctors. We are equal to them, and probably we are more talented than them, because we deal with each and every case, and it's not simply writing a medication and ending up. We have to treat the patient on that day itself. And next is, so importance is, see, basically BDS is not that important, and scope of dentistry in India is questionable. Why? Because people are neglecting the oral health. So why not, if we create any awareness, we can come back again, we can maintain our dentistry. And how to come up is giving awareness, that's it. Why are we all are rushing towards abroad and making our India a very uncertain place to stay as a dentist? Is nothing but, the only thing is no more awareness in public, and the public are just dealing that, oh, tooth pain or tooth loss, it doesn't matter to them. But we have to spread awareness that every tooth which is in our oral cavity is more than a diamond. And so every 6 months a dental visit or a dental consultation is mandatory. And next is, what are the opportunities related? So if we want to stay in BDS and should pursue dentistry lifetime, we can be a clinician, we can be a consultant, or we can be a academician. And next, there are various branches in dentistry. It's not a single course, and we have different branches, starting from oral medicine and radiology, which is involving with the diagnosis and treatment plan. Later on, we have oral surgery, which deals with extraction of teeth and trauma cases and fracture cases. And later on, we have, moving ahead, we have a public health dentistry, which deals with each and every aspect of the dental related problem, and public health awareness is dealt in that. And endodontics, which is